deals with death. And I know you guys don't like to talk about death, but we need to understand how other people feel, how other cultures feel about death, and how they deal with it. So please bear with me. If you start feeling uncomfortable, you can turn off the video. Shouldn't be too long. It's only 41 slides, but let's go ahead and get started. We're going to talk about the dusk of life, chapter 13. As recently as the turn of the 20th century, 50 out of every 1,000 people in the United States died every year. In Europe, during plagues and natural disasters, as many as 40% of the population might die. 1/3 of all babies died in infancy. This is at the turn of the 20th century. 50% of children died before their 10th birthday. So this is the situation we were in all over the United States. I know the figures are abysmal for indigenous peoples, but it was also fairly dismal for everybody. And this has to do with vaccinations. Most of the children were dying from childhood illnesses like measles, mumps, chickenpox, whooping cough. These were all killing, half of them before they reached their 10th birthday. So it was a bit of a surprise when a family had more than one child that survived to be 11. Death was normal and death was expected since they were losing so many babies in childbirth. They were also losing mothers in childbirth. It was a pretty grim time. During the 20th century, advances in medicine from surgical techniques to antibiotics reduced death rates and increased life expectancies all over the world. Death rates have now fallen to 9%, and infant mortality is below 1% in the United States, whereas it was 33% at the turn of the 20th century. Children rarely succumb to childhood illnesses. Adults most often live to retire, and older individuals now are given the medicines to fight off formerly fatal illnesses. And one of the things that we need to remember about the past, the 19th century perhaps, adults didn't live to develop Alzheimer's disease. Adults didn't live to develop cancers. They died of something else. They died of pneumonia. They died of the flu. They died of smallpox. They died of all kinds of illnesses that were out there, and they were infecting large masses of people. Everyone, not just indigenous people. The first generation to reach adulthood with only 5% of the population ever experiencing death in their presence was the baby boom generation, children born between 1946 and 1964. And this is me. This is my generation. I was born in 1949. Only 1 in 3 people died at home. People rarely thought of their own deaths. Today, however, death tends to be getting closer to people as violence, drug abuse, COVID-19, and AIDS becomes more prevalent around the world, especially shooting deaths. We've had a lot of shooting deaths in the United States. I don't know if I've really told you about my experiences with death, but I was a lab tech in the Air Force for 12 years, and one of my jobs, we were the ones that did the autopsies for. We were the morgue for the emergency situations, which you practice these from time to time, and every once in a while something happens. We were lucky that we only had airplane crashes that only took 2 or 3 lives, but when I was in Germany, we had a C-130 that went down, and there were 9 people aboard when they went down. So we were the ones that had to accept the bodies. The other thing that I have done as a lab tech, working as a civilian, we were the ones that maintained the morgue So I've been around a lot of people that have died. Working in the emergency room, of course, that kind of thing happens. People come in, and normally, if somebody comes in and they have already died, they will come into the emergency room. They won't take them directly to the morgue. So, as working in the emergency room, working in ICU, working in CCU, working in ICU, working in the laboratory, I've seen a lot of death. The other thing is that when my wife was stationed in California, and I was going to school at the University of California, Riverside, I was working at the National Cemetery in Riverside, California. So this has been kind of my life, and it's just the way it works. You know, somebody's got to do it, and I was the one that did it. There are at least three aspects of death: biological death, social death, and psychological death. Biological death is the definition of death when the bodily functions cease. So, how do we know when they're dead? The heart stops beating, they stop breathing, and brain activity is non-existent. Social death is the basic social attitudes toward death we deal with, and your taboo would be considered a social attitude. And psychological death, both the dying and their bereaved, and of course this is always the fallout from when someone dies. What kind of response will you get from the people that are still alive because of this death? Before modern medicine allowed physicians to maintain a dying patient indefinitely, biological death took place when the heart stopped beating and respiration ceased. The brain was starved for oxygen and all living functions stopped. Now we have the capability of breathing for an individual and maintaining a heartbeat indefinitely. Life support can be maintained indefinitely despite the fact that the brain has no awareness. The other thing that we know now is that even when somebody dies, there's still some degree of activity in the brain that we can stimulate. As weird as that sounds, and I'm not going to tell you how they came up with this, but in the future, we may be redefining death. This is something that they determined with research looking at pigs. So hopefully this won't become a huge issue in the future, but it looks like we may be redefining death in the future. Because of our ability to maintain people indefinitely, the AMA developed a new definition for death, and the AMA is the American Medical Association. Irreversible cessation of circulatory and respiratory function, and there is a point where uh, you cannot repair the circulatory system if it stops. When the blood starts to clot, um, pooling takes place. That is After that, it's impossible to bring the person back. Irreversible cessation of all functions of the entire brain functioning, including the brainstem. And the brainstem, of course, is what controls your respiration and your brain function, your heart function, and your respiration. So when the brainstem is no longer functional, then that is death. That is considered death as well. However, people can live for an extended period of time with only their brainstem functioning. It's a state referred to as a persistent vegetative state, and this is true. And of course, we've done this over time. I worked at a hospital where we were the ones that maintained people that had died. And the way that we did that was to stimulate their brain stems to keep the oxygen flowing into their brain, despite the fact that the brain had flatlined. And we breathed for them and we circulated their blood. And that's how we maintained them. Now, you may want, that sounds kind of ghoulish, but the reason we were doing it was so that we could harvest their organs. I know that sounds ghoulish as well, but and we didn't transplant anybody, but we were the ones that that maintained the individual, even though they had been declared dead. We were the ones that maintained them until they could harvest all the organs. Normally, it didn't take very long at all. That sounds really horrible, I know, but this was in Omaha, and we had two hospitals, Clarkson and the University of Nebraska Medical Center, that actually transplanted organs, and we saved hundreds of lives that way. But somebody had to do it, and we were the major trauma hospital for the area, and so we were the ones that did it, and we would keep them in ICU until they died, or until they had harvested everything that they were going to harvest. You'd be surprised some of the things that they are able to transplant. Corneas in the eyes, lungs, liver, kidneys, heart. Um, it's just amazing. Social aspects of death and dying. Many social aspects of death and dying are governed by religious or legal prescriptions that tend to reflect a society's attitude toward death. Embalming is a social custom that has become a law in most states. In most states, if somebody dies, then you have to embalm them. Whether you get them, whether you bury them very rapidly, really doesn't matter. The law states, in some states, that they have to be embalmed. The Jewish practice of standing watch, or shomer, over the deceased until they are buried is also a social custom, and they will watch. The Catholics also have what they refer to as wakes, and sometimes the wake will last for days, for 3 or 4 days before they bury them. When I worked at Fort Belknap, the reservation in Northern Plains Indians in Montana, um, most of them were Catholic, but no matter whether they were Catholic or not, they always maintained a wake, especially for veterans, and it had to be they had a guard that, and I pulled guard duty, and I always got the worst times. Just standing guard over another veteran standing guard over the body in their casket, and sometimes, of course, this would last for 2 or 3 days, depending on who it was and what they wanted, and what the family wanted. Anyway, in the Jewish community, when a friend or relative dies and someone hears of their death, they ritually tear an article of clothing that they will wear for the rest of the day, and this is known as keri-ah. After the funeral, a group of male relatives, at least 7, will gather and share and vent feelings of the deceased, and this is known as sitting Shiva. So they're supposed to be Jewish, but in some situations they will sit Shiva with somebody who isn't Jewish, and I have done that as well. All of these rituals help the bereaved confront the reality of death, and that's really what we're trying to do. The study of death is called thanatology. Many people believe that people must not only learn to deal with the death of someone close to themselves, but also their own death as well, and this is known as death education. Hospice care is care given to someone in a controlled setting, but outside the hospital. Some hospice care is provided in spatial housing where medical care is available. Other hospice care is at home by medical professionals. Throughout most of the 20th century, medicine allowed people to get farther and farther from death. People died in a hospital away from all but the closest relatives. But the AIDS epidemic in the early 80s changed all that as more and more people contracted the nearly always fatal disease and expired slowly. And of course, they didn't come up with, they didn't even know what it was for about 5 years. And so there were a lot of people who were suffering from AIDS, and there was nothing that they could do for them. But then finally, in the middle 80s, enough research had been done and they were able to slow down the process of the disease, and now they can't eradicate it, but they can slow it down to the extent that the individual, isn't always a fatal disease now. It used to be. I can remember when the AIDS epidemic started, I was working in a hospital in Omaha, and we didn't, at the time, I'm laughing. At the time, we didn't have to wear rubber gloves to draw somebody's blood. We could handle specimens without worrying about contamination. Of course, syphilis was still around, and hepatitis C. Hepatitis C actually wasn't that prevalent, but there was always the possibility of syphilis, but it was so rare that they didn't really force anybody to wear gloves. And now, of course, you have to wear gloves and masks uh, just about all the time. And of course, with the pandemic, other things. That is another reason for making sure you're always clean. I can remember coming home with blood from the emergency room on my shirt and on my pants, in my lab coat, and it was no big deal. As a matter of fact, emergency room personnel. Well, that was, it was a badge of honor if you were wandering around with blood all over you, because that meant that you had been in the trenches and working and trying to get things done. But with the AIDS epidemic in the early 80s, all this changed. The process slowly declining to death is referred to as a death trajectory. And of course, that uh, became very prevalent with the AIDS epidemic. Lingering pattern of dying, the individual is expected to die but clings to life longer than expected. A short reprieve pattern, lingering pattern of dying, we see this with a lot of different diseases. Certain cancers, pancreatic cancer, is very frequently fatal. It has a higher death rate than it does a survival rate. Short reprieve pattern, the person's death is postponed unexpectedly, cancer goes into remission, but the reprieve tends to be short-lived or short-lived. Abrupt surprise pattern, the individual is expected to recover but unexpectedly dies, and this happens a lot. Usually it has to do with older individuals who can't, um, uh, their power of resilience is weakened because of their age, and a lot of times they'll get sick and then the next day they're gone, and you're going, wait a minute, this is not that serious, but they just don't have the resilience that they once did. Suspended sentence pattern, a person was in the hospital to die but is suddenly discharged from medical care because the crisis has passed, and that happens with a lot of different problems. Heart disease sometimes is that way, cancers are sometimes that way. Re-entry pattern, the person steadily declines but is able to remain home between periods of hospitalization, and we see that from time to time as well. The terminally ill will often pass through three phases. The first phase, of course, is the acute phase. It is a crisis that causes high stress and increasing awareness of the inevitability of death. Chronic phase is an adjustment period when the individual resolves their feelings toward their own demise. And then the terminal phase is where the individual withdraws from others and disengages from the world because of their impending death. When the individual enters the terminal phase of death process, often you will notice marked accelerated cognitive degeneration. This is called terminal drop or terminal decline, when the focus tends to be inward and the individual stops eating or drinking, or at least has to be reminded to eat and drink. Especially drinking, it's really odd that yeah, you have to remind people. Dehydration is very common with the terminally ill. Top 10 causes of death in the United States in 1900. Number one was pneumonia. And now, of course, hardly anybody dies of pneumonia. It's not that common. Tuberculosis is another infection. It's another bacterial infection. Pneumonia is usually a bacterial infection. Diarrhea and enteritis is another bacterial infection, can be. Usually it is. Heart disease is not. Chronic nephritis, Bright's disease is a bacterial infection. Unintentional injury, accidents, of course. Stroke, just like in today's society. Diseases of early infancy, and these are mostly viral infections. Cancer is number 9, and diphtheria is number 10. Diphtheria is another bacterial infection. So if we look at this, we can see pneumonia, tuberculosis, diarrhea, enteritis, chronic nephritis, Bright's disease, becomes chronic, starts out as a bacterial infection, diseases, okay, and diphtheria. So 5 out of these 10 are actually bacterial infections. Now, if we go to the 10 causes of death in people over 40 today, cancer, heart disease, 31% of deaths are due to cancer, 21.7% are due to heart disease, unintentional injuries, 7.6%, poisoning, motor vehicle accidents, falls, diabetes, 3.6%, cerebrovascular disease such as stroke, 3.6%, and we don't have the rest. Well, anyway, so whereas 5 of these diseases were bacterial infections, now the top 10 causes of death, that's this here. Let me find that. Top 10 causes of death. Top 10 causes of death in America. There we go. Let's do that one. There we go. Okay, top 10. Heart disease, cancer, COVID-19, accident, stroke, chronic lower respiratory diseases, Alzheimer's disease, and diabetes. Only one of these is a bacterial infection, and that is chronic lower respiratory diseases. So whereas at the turn of the 20th century, 5 out of 10 top killers in the United States were bacterial, now there is only one. And the reason is because we have antibiotics. And let me see what this says. Well, there's nephritis, which starts out as a bacterial infection. So there you go. So things have changed, and the reason they have changed is because we have developed antibiotics, which, there we go, antibiotics. And that's why people don't die from bacterial infections now. There you go. This is something you need to think about. You know, if a lot of bacterial infections back when we were, that's one of the reasons why the Spanish, what we refer to as the Spanish flu, the 1918 flu, it just swept through the world. And the reason it did is because it started in a army camp in Missouri, I think, in the United States. And because everybody was packed in close together, a lot of people became sick. People face their own death differently. In young adulthood, people tend to feel invulnerable. They maintain a personal fable. Thus, when other adolescents die, the usual reaction is, it can't and won't happen to me. This is famous last words. It can't and won't happen to me. That is the way it is with death. It's also the way it is with pregnancy. Yeah, okay, Sally got pregnant, but that's not going to happen to me, even though I'm having sex every very relatively frequently. I'm too smart for that to happen. And then, the next thing that happens is positive pregnancy test. While this attitude tends to become more realistic, the more responsibility the individual acquires, job and family, there is still an air of invulnerability in their actions. By the time someone reaches middle adulthood, they are usually resolved that they will someday die. These individuals begin looking at how much time they have left instead of toward the future. People begin planning for retirement and accumulating money to see them through in their old age. Middle-aged individuals begin working towards saving as much time in life as possible. The phrase "life is just too short" enters the vocabulary at this time. People like to think, well, I'm only about halfway through, right? I'm only about halfway through. Well, I'm 73, and I know that I'm not halfway through. So I know I've got about 30 years left, and that's about it. That maxes me out right there. That'd make me 103. As people get older and move into late adulthood, they become less anxious about death. They're more likely to use emotion-focused coping strategies. With the mounting losses of friends and relatives, the individual gradually recognizes their own mortality. Many are old and infirm, but they seem to be coping with their situation. 2 out of 3 people surveyed as to whether they would trade good health to die earlier took the time alive over the good health. Yeah, so one of the things, like I said, I'm 73 years old. I graduated from college in 1971. About a third of my graduating class from my college graduating class, there was about 250 people. About a third of them are no longer with us. They have died. I have a record, a college record in track. It was a relay record. There were 4 of us on the relay team, of course. 2 of those people have passed away. They are gone. So there's only 2 of us left that hold that record, and we've held it since 1969. That's 55 years. We've held it for 55 years. That's a long time. I also hold one of my high school track records. It's also a relay race, and but only one of those individuals has died. But in my college record, 2 people are already gone. Approaching death, psychological chances often take place even before there are overt physiological signs of dying. Terminal drop often appears at this time. It is the acceptance of mortality, the seeming impairment of intellectual abilities, and the distancing oneself from friends and family. Terminal drop is often attributed to chronic ailments, but it is seen in people of all ages who are near death, not just the old. And of course, I did work in a children's hospital in Omaha, and I saw 3, 4-year-olds doing the same thing, this terminal drop. Elizabeth Kubler-Ross from Cornell University did studies on thanatology and discovered that most people go through 5 stages before they die. Denial is the first stage. I'm not going to die. Anger, you're angry because you've got cancer and you're going to die. So you're angry at God or whatever. Then you bargain with your God, trying to gain a little bit more time. Then you go into depression, and eventually you ultimately will accept your death. Now, it's really kind of interesting because Kubler-Ross and her stages of dying, she has since died since she came up with these 5 stages of death, and she she was kind of happy just before she died because she had gone through all 5 stages, and she was really kind of happy that she got it all right. Thanatologists have discovered that people actually attempt to hold on to life until they reach a certain milestone death. Fascinating. So if you're working in the hospital on Christmas, that you get a lot of deaths on Christmas. You get a lot of deaths on New Year's Eve. They want to make it to the next year so that their headstone will have them a year older. It looks like a year older anyway. Anniversaries, birthdays, it's really weird being around. We had a lady when I was working hospital in Omaha. And she seemed okay. She seemed fine, and they had a big party for her on her birthday. And that night, she died. It's really kind of weird. She seemed perfectly healthy up to that point. I even had a piece of her cake, and I drew her blood that day, if I remember correctly. And she had nice, nice circulation going. Everything was seemed to be fine. We were thinking maybe she'd leave the hospital, and then that night she died. Very often, the milestone date is a birthday or an anniversary. Religious people tend to hold on until after select religious holidays. Easter's huge. Terrible day to work the graveyard shift, and there's a reason why we call it the graveyard shift. For one thing, the graveyard shift is during the night. It's from 12 o'clock at night to 8 o'clock in the morning. And it's a really tough time to work because everybody else is asleep and you're the only one awake. That's one reason to call it the graveyard shift. But the other reason is because in hospitals, that's usually when people die. They usually die between 12 o'clock and 8 o'clock in the morning. Why? Because their blood pressure is the lowest at that point. Anyway. Thanatologists don't want to make the studying of death too easy. They have taken words that seem to mean the same thing and given them different definitions. Bereavement is the loss of someone to whom one feels close and the process of adjusting to it. So what's the difference between bereavement and death? Well, only thanatologists know because they're the ones that made it up. Bereavement can affect all aspects of someone's life, including their social or community status or their roles. Grief is the emotional response experienced in early stages of bereavement. Grief can range from anger to emptiness. Both grief and bereavement tend to be defined through cultural contexts. Mourning, spelled with a U, is the behavior that an individual participates in after the death of a loved one. This is very much culturally dictated. The Irish have all-night wakes where friends and family toast the memory of the deceased. They have a big party. Flying a flag at half-staff is an example of mourning. In Japan, the bereaved are encouraged to maintain contact with the deceased. They cremate their dead and place the urns in family burial plots. They create shrines to their ancestors in their homes and feed them as if they were there. And this is not only done in Japan, but it's also done in Korea and China to some extent. Some Southwestern Native Americans do not speak of the dead for fear of being contaminated by their dead spirit. Patterns of grief. Anticipatory grief is the feeling of anticipatory loss that people feel before someone dies. Anticipatory grief is actually adaptive in that it tends to help the individual prepare themselves psychologically and practically for the loss of their friend or relative. And my mother was 98 when she died, and we were she wasn't really sick, she was just old, and she was worn out, and she'd been that way for 6 or 8 or 10 or 12 months, and so we were all thinking, gee, I wonder when she's going to go. I wonder when she's going to go. Well, when she finally did go, we had thought about it so much that it didn't bother us as much when she did die. I know that sounds kind of callous, but we had thought about it and thought about it enough, and nobody cried. That was just the way it works, and I think I tell you that my family doesn't cry. It's not that we don't cry, it's just we don't cry for death. Grief work. Thanatologists studying the process of grief discovered a 3-stage pattern. Shock and disbelief is the first stage. This may last several weeks, especially if the death was unexpected. The individual feels lost and confused. They seem to be unable to believe in the death. This may actually protect them from more intense reactions. Normal physical reactions may include shortness of breath, tightness in the chest or throat, nausea, feeling of emptiness in the abdomen. The numbness will eventually give way to overwhelming feelings of sadness. And this will, of course, lead to crying. Stage 2, preoccupation with the memory of the dead person. The second phase may last 6 months or more. The survivor is trying to come to terms with their loss, but cannot yet accept it. Physical reactions include insomnia, frequent crying, fatigue, loss of appetite. They may relive their lives together and their entire relationship. At times, the survivor may feel that the deceased is present, even to the point of seeing their face. These episodes diminish with time, as do vivid dreams of their relationship together. Resolution is the third stage. The final phase, of course, arrives when the bereaved renews interest in everyday activity. Memories of the deceased now bring fond feelings mingled with sadness, but is no longer a sharp pain and longing. They will become socially active again. This is especially important in widowers in that they tend to have a less entwined social network. Grief therapy is counseling that can help the bereaved cope with their loss. And this is something new in the DSM-5. I've got the book over here. Wait a minute. What is it? It's a DSM-5 TR. They've added a bereavement, chronic bereavement in the book. Let me find it. I can read it to you. Sorry, it was across the room. Let me see if I can find it. I don't have the light on, so I... bereavement. Yeah, this is new in the DSM-5 TR. Uncomplicated bereavement, phase of life problem, spiritual problem. Yeah. So they've added a type of bereavement that is chronic and doesn't go away in the DSM-5. I can't find it. I guess I should have thought about this before I started the lecture. Huh? What do you think? Okay. Anyway, so it's new in the DSM-5 TR, which just came out last year, and I got a copy of it. And it's fluorescent blue. The book. They're always different colors. There are many misperceptions about death, dying, and grieving. Researchers have discovered that depression is far from universal. Only 15 to 35% of grieving survivors now show signs of depression. Failure to show distress at the outset does not necessarily lead to problems. In fact, the people who showed the most distress were more likely to still be troubled after 2 years. So the less distress you show, the less likely it is to stick with you. Not everyone needs to work through a loss or benefits from dying, so some people who worked through their grief had the most severe problems. Surviving spouses, not only do women tend to live longer than men, but in the majority of marriages in the United States, the woman marries an older man. Widows tend to be worse off economically than widowers. Widowers are when the woman dies first, the wife dies first. In the United States, and the man is referred to as a widower. In the United States, 40% of women over 65 are widowed. In the United States, 14% of men over 65 are widowed. Among women who are over 85, 80% are widowed. Among men over 85, only 43% are widowed and not married. The average white woman is widowed at 56, the average African American woman at 49, and the average Hispanic woman at 48. Losing a parent, half of all children become orphaned by the time they are in their mid-50s. 75% by the time they reach their 60s. Grieving for parents may last longer than for other deaths. 25% of bereaved adults still have emotional problems 1 to 5 years after the death of their parents. This included sadness, depression, and thoughts of suicide. 50% continued to have physical reactions in the form of illness, fatigue, and general decline in health. Euthanasia is the act of allowing or assisting someone to die. Euthanasia has been practiced in the United States for decades. Doctors who have wanted to stop the pain and suffering of a terminal patient would merely stop making overt attempts to keep them alive. Withholding or discontinuing life-sustaining treatment is known as passive euthanasia. Dr. David Kevorkian, or Jack Kevorkian, however, actively assisted people in seeking their deaths, and this is known as assisted suicide. Even before Erickson, people tended to review their lives before they died. This is referred to by the thanatologists as a life review. Life reviews seemed to be beneficial for all people, but especially those who looked back and saw a true purpose in their lives. These tended to be the people who feared death the least. Ritual is important for Hinduism, which includes bathing the body with holy water and draped with white cloth, sprinkling rice on the mouth, cremation with only men present. Ashes are scattered on the 31st day. A memorial service is held at that time, and that's how Hindus deal with their dead. Buddhism rituals include presence of monks being important, bathing ceremony after death, cremation, feast held on day of the cremation, continual prayers performed by monks, and that's why monks are so important. Judaism tends to have a community of volunteers. The body is washed and purified. The body is dried and wrapped in linen. The family members enter a 7-day mourning period, followed by a second 30-day period. The coffin can have no nails and no handles on it, nothing metal on the coffin. As I told you before, I used to work in a Riverside National Cemetery. It was tough. I'll tell you, we used to have to use straps in order to handle the Jewish coffins because there were no handles, and that's what we were used to. Three or four handles on the sides of the coffins, and that was my job. One of my jobs was lowering the individual down into the grave, and it was pretty tough with the Jewish coffins. Two major mourning traditions in Christianity: Catholic, anointing the sick, followed by the vigil, and a requiem mass is held afterwards. That's with the Catholic Church. The Protestant Church, they may have a funeral service, which includes a eulogy or saying nice things about the person that has died. Protestant tradition is less ritualized than Catholic tradition, and one of the reasons is because there are so many different denominations of Protestantism, so many different types of Protestantism: Presbyterian Church, Episcopalian Church, Seventh-day Adventists, Baptists, Methodists, on and on and on and on. Church of the Nazarene, Church of God, Church of Christ, just a ton of different denominations. Islamic rituals include gathering near deathbed, reciting the Quran. The body is bathed and burial takes place shortly after death. Cremation is forbidden. Body laid on their right side facing Mecca. 3-day mourning period with wives mourning for 4 months and 10 days. So as you can see, everybody does it differently. But everybody has a formula. The Hindu, the year anniversary of death of the deceased, the favorite food is prepared. In Buddhist faith, they have ancestor worship. Therefore, they go back every year. The Jewish Yahrzeit, candle lit for 24 hours and prayer recited 3 times a year after they die. Christian 3-day period called All Hallows Eve. This is something that's huge down in Mexico. They have the Day of the Dead, and that's what they're really talking about Muslims visit the graves, they show respect, and they offer prayers. And that is the end of the chapter. So I will talk. That's it. That's the last chapter. We are done. So had a good had a good semester. I hope you learned something. There is no final in this class, so you don't have to worry about that. Just quizzes, discussions, and the paper, and that's it. So I will. Hopefully, I'll see you in the future, and if not, then have a good time at Dene College.